Okay, I believe you're all online and you're all connected. So welcome to the Europa Conference, and thank you for joining us today for this roundtable on the topic of universal health coverage. Is the EU doing enough? My name is Dr. Raphaela Kitson-Pantano, and I will be the moderator today of a 19-minute discussion. Now, we want this session to be as interactive as possible, so do not hesitate to post your questions in the chat box as we go along. I do not promise to answer all of them, but I will read them and I'll try to fit them in the discussion as we proceed. And as you'll see, the first questions will be to each of our individual speakers, and then all the other questions will be for the three of them at once. Whoever gets it, and they will all hopefully interact with one another and respond to the questions that you'll put in the chat box. So conscious of time, let's get started. First and foremost, wherever you are right now, listening to this debate, just take a moment to look around you. 1 in 2 people in the world does not have access to the health services that they need today. That's half of the world population. Every year, about 100 million people fall into extreme poverty because of excessive health spending. 100 million people, that's approximately 3 times the population of Canada. And 200 million people spend more than 25% of their income on health. To give you an idea of what that is 3 times the amount of people living in France who spend a quarter of their income on healthcare. Now, the World Health Organization defines universal health coverage as access for all people to the health services they need without financial hardship. This includes prevention, promotion, treatment, and rehabilitation. But universal health coverage implementation is a daunting undertaking for many countries. To commit to it, countries and their leaders must address questions such as, can the country afford it? What services should be provided? Who should have access to them? Who should be responsible for managing insurance? And how can providers project demand and ensure adequate supply of services? Health ministers, who often serve only short terms, must address these questions about universal health coverage whilst also managing policy and services for many other health issues. Obviously, the COVID-19 pandemic will have exacerbated these concerns, and we will discuss this later on in the debate. According to the 2019 UHC Global Monitoring Report, the world will need to double health coverage between now and 2030. It warns that if current trends continue, up to 5 billion people will still be unable to access healthcare in 2030. The European Union is engaged in helping the World Health Organization achieve its goal of reaching 1 billion more people benefiting from universal health coverage by 2023. That's in 2 years from now. Its actions include coordination, policy dialogue, technical assistance, and encouraging countries' ownership of their own health systems. But to what extent is this enough? To discuss this with me today, I have the pleasure of welcoming 3 distinguished speakers. Elena GRAEFF, who is Head of Public-Private Partnerships of AXA Life and Health International Solutions at AXA France, and who will be representing the private sector standpoint in this discussion. Alex Ergo, Director of Health Systems at the NGO Population Services International. And Matthias Reinicke, a public health expert and external consultant for the European Commission's Directorate General for International Partnerships. Thank you, Elena, Alex, and Matthias for joining us today. So let me start with you, Alex. Together with universal health coverage, health system strengthening is integrated in the targets of the third Sustainable Development Goal of the United Nations. And you are currently shaping and leading PSI's youngest department, the Health Systems Accelerator. Can you tell us a little bit more about what that does and how it contributes to the UHC goals?
Yes, absolutely. Thank you, Raphaela. Good morning, good afternoon, good evening, everyone. First, maybe I'd like to thank Europanova for organizing this event and for inviting me to join the panel. I'm really delighted to be here and I look forward to a great discussion. So perhaps I should start by saying a few words about PSIs. I'm not sure everyone attending this event knows the organization. So PSI is one of the larger US-based NGOs working in the health sector. It's been around for more than 50 years, and it has a presence in 46 low and middle income countries around the world. And for a long time, PSI was mostly known as a social marketing organization with an initial focus on family planning that then gradually expanded into other health areas, including HIV/AIDS, TB, malaria, water and sanitation. And all along, the focus of the organization has been on the consumers, on understanding their needs, their preferences, and their actual behavior, and also on making markets work so that consumers can access the essential health services and products that they need. Over the years, PSI's approach has evolved, culminating into our current global strategy, which focuses on scaling what we call consumer-powered healthcare. Now, what does that mean and how does that relate to universal health coverage? To answer that question, I'll need to give you a little bit of context. So many of the countries where we work tend to adopt strategies to move towards universal health coverage that are very top-down. When it comes to improving supply side readiness, for example, ministries of health tend to focus on strengthening or expanding the network of public sector health facilities with the underlying assumption that if the service is made available, people will use it. And generally speaking, there's a little effort to understand and let alone respond to the behavior, the preferences, and the needs of the consumer. And in many countries, for example, large share of the population prefers to go to the private sector when they get sick, whether it's a GP clinic, whether it's a pharmacy, or an informal drug vendor. And they'll end up paying considerable amounts of money out of their pocket for services and products that are very often of questionable quality. And that has a lot to do with the lack of regulation, the lack of oversight of the private sector. So ministries of health are supposed to be the stewards of the entire health system. But unfortunately, in many of the low and middle income countries where we work, they're not really playing that role. So what you often see is that there's a lot of mistrust in the private sector, and there's not much effort from the government to engage with private healthcare providers. Now, this is slowly changing. More and more governments do realize that the public sector alone will not be able to reach everyone with essential health services, and that a closer collaboration with the private sector is a necessity. But the problem is that the functions, the systems that are needed to effectively engage private healthcare providers are either not in place or they are poorly developed. So what we feel is needed at PSI is to complement that very top-down, public sector focused approach that I just described with a more bottom-up approach that places the consumer at the center. And what we feel is needed is to shape stronger and more efficient mixed health systems. And what I mean by that is systems that better connect and integrate the different layers of the health system, from self-care all the way to secondary care, systems that better connect public and private sectors, and that allow public funding, public money to flow to private healthcare provision. And all of that so that these systems become more responsive to the consumer's needs and preferences. We also realize the importance of harvesting digital technology that will help us connect, or as we like to say, to wire all the different actors in the system and create more integrated primary healthcare ecosystems that move affordable, quality care closer to the consumer, and that are easier for the consumer to navigate. So one of the main goals of the department that I'm leading, the Health Systems Accelerator, is to facilitate that marriage between the top-down and the more bottom-up approaches, and to facilitate the shaping of mixed health systems that are more responsive and more resilient. And I'll stop here. Over to you, Raphaela.
Thank you very much, Alex. That was very, very interesting. I just want to make sure we're all on the same page. And so I just want to give our audience three very brief definitions. What we mean when we talk about primary care, and Alex mentioned it, primary care focuses on general care for overall patient education and wellness. Secondary care, which Alex also mentioned, is medical attention provided by a specialist facility upon referral by a primary care physician. And tertiary care, which I believe Elena is probably going to tell us about, is provided by a team of specialists in a major hospital. So just so that you know, these are the three types of care that we talk about. And Elena, what Alex was saying is so true. The private sector continues to frequently be overlooked as a critical part of the health system. And yet private insurers such as AXA are committed to supporting countries develop and strengthen their health systems. So can you tell us what the private sector and a private insurer can actually bring to the table?
Oh, yes, absolutely. And thank you, Raphaela and Nova, to organize this exciting debate about a very exciting and passionate discussion, which is the and challenging topic, which is the universal health cover and giving access to the most vulnerable. And thank you, Alex, for the good introduction to the next topic and to the role the private sector can play. Well, definitely. Private sector, and specifically private insurers, could be highly beneficial to address the UHC challenges, UHC meaning universal health cover challenges. But before discussing the added value of the private insurers, it's important to explain why the private versus the public is overlooked as critical in the health system. There are some context and sometimes some stereotypes also, but I will share with you some numbers given by WHO reports just to have the global picture and why we're talking about the importance of the public versus private. The world healthcare spending represents 10% of the global GDP, which is approximately $8.5 trillion US. As you may expect, this is a massive budget, which is unevenly spread across the globe. In high-income countries, representing 20% of the total population, 80% of the global health budget. The high-income countries represent 20% of the world population, but in the same time, it represents 80% of the global health budget, and 70% of this health spending is public. This percentage falls down to 50% in the middle-income countries and only to 20% in low-income countries. So clearly, especially in middle-income countries, public spending must increase significantly to give access to the most vulnerable, having in mind that this area accounts for 62% of the world's poor and the highest percentage of the informal workforce. So therefore, it is a fact that governments play a substantial role in the health systems, and that the public spending is and must stay predominant. But also there is a question mark on the financial sustainability and access to care. So a successful implementation of universal health cover is crucial, and it requires a holistic view and expertise. some of the main challenges that governments of low middle income countries trying to implement universal healthcare are facing are who to protect, how to finance sustainably, and how to structure it. These are very important challenges. So public-private partnerships can be highly beneficial to address these challenges, combining a strong state involvement, including regulation, as mentioned by Alex, and insurance management, balancing the role of the public and private sectors to promote efficiency, to ensure sustainability, and to improve quality of care. So to answer the question that Raphaela asked me about the added value brought by the private sector, I would say insurers can play a vital role in helping governments to build and run efficient and viable health systems. But how? I would say by actively participating throughout the entire chain value, insurers can first help to design a sustainable strategy for equitable and affordable access to care. Second, leverage their large experience in implementing massive projects, relying on a wide range of skills and resources. Three, to give budget visibility to the government by transferring the risk and associated volatility at fixed costs. Four, to guarantee a cost containment, really crucial to guarantee a sustainable scheme, limiting the leakage through data analysis and fraud monitoring. And finally, it's also important and helpful to attract investors to make up for the lack of medical infrastructure. As an example of commitment and involvement of private insurers, I'm really proud to mention that this is the way how AXA Group, one of the top leading health insurers on a worldwide basis, participates actively in addressing UHC challenges, more specifically by filling the gap for secondary and tertiary cover. The group's conviction is that there is a role to play for our customers, and this is probably the stereotype for private insurers, that they are giving protection for the most wealthy, but not only. This is also our role to play for the society, and the group actually is leading and supporting several public and private initiatives in mature, but also mainly in emerging markets to give healthcare access to the most vulnerable.
Great. Thank you very much, Elena. That was very interesting, and well done on AXA. Effectively, AXA's commitment is undeniable. Matthias, you're our EU expert on the panel. The EU participates in global initiatives supporting universal health coverage. There are two I wanted to talk about because I wanted clarifications on them. There's something known as the UHC partnership and UHC 2030. Now, the UHC partnership supports policy dialogue in 115 partner countries around the world and aims to bridge the gap between global commitments and implementation on the ground. And UHC 2030's mission is to create a worldwide movement for accelerating equitable and sustainable progress towards universal health coverage. And it provides a multi-stakeholder platform that promotes collaboration at all levels to strengthen health systems, increase political commitment to universal health coverage in all countries, and reinforce accountability and knowledge sharing. Now, all this sounds incredibly exciting and very promising, but to tell you the truth, I'm not actually sure what it really means when you get into the nitty-gritty. So concretely, what is the EU actually doing, and to what extent is it successful in its endeavor?
Thank you very much, Raphaela, and to start with, thank you very much to Opanova for inviting me. Very pleased to be here. It's a bit tricky as I was for 6 years in charge of the UHC partnership. So I have to balance a little bit objectivity and criticism. The question is straightforward and it's tricky to respond to. What is the EU doing? If I talk of the EU, just to clarify, I mean the EU institutions in this context, and this means the European Parliament, the Council, and the Commission. And to another institution is the EIB, which in this context will play a role, but has not done to this extent until now. Now, what is the EU doing? The idea of the EU, meaning the European Commission, was to support the WHO in promoting universal health coverage, and that actually before the Sustainable Development Goals were approved in 2015. And the idea was that until then, the European Commission supported WHO in separate areas, be it human resources, being it for tuberculosis or other disease-specific programs. And then it was found that probably a holistic support to WHO would be much more helpful, and to give WHO the flexibility. And so this partnership was started in 2011, exactly 10 years ago, with 7 countries, with various objectives. Number one was to help through WHO countries to strengthen the health systems. That was the very first thing: health financing, human resources, and other areas. Secondly, it was also to strengthen WHO as a convening partner, because WHO was not very much on the map as the interlocutor with governments in the place. And thirdly, the idea was and is to help WHO itself getting away from its vertical organization and becoming a more interlinked organization. And this was the beginning, and runs until today. You just mentioned 115 countries. Now, what do we do? The EU Commission provides funds to the World Health Organization, which in turn delegates the funding to the various regional offices and then down to the country offices, where in the process advisors have been recruited. And if you think about it, it's basically a very similar, it's a small amount. It's about $200,000 to $300,000 per year per country. This is not big money. Exactly. But it made the difference in locating specific advisors with a portfolio and the expertise requested by governments for their priorities. They wanted WHO to help them to get up to speed, whether it was in the national health insurance system, South Africa is an example, whether it was in developing a new health policy, Tunisia was an example, whether it was in shaping up the human resources strategy, Zambia is an example. WHO with this funding provided then the means. And by the way, it is not only, of course, the European Commission. Luxembourg joined very early on in 2012, and then it was Ireland, the United Kingdom, Japan, lately Belgium, France has joined. So there is a large group of donors who is supporting this partnership. Well, did it have any effect? The answer is yes. If one looks at the results achieved in these 10 years, specific results, as I just mentioned, 3 were achieved. This is the UHC partnership. I'm coming to UHC 2030. Could we do more? I think we could do it differently, and this is how the EU starts now, to work in very close conjunction with the EU member states, the 27 member states. And for the first time, the new Commission has put up a so-called Team Europe initiative. Where
yes, I was going to bring you to that, especially in the second part of the debate. I'm happy you mentioned it. Yeah,
exactly.
Absolutely.
So, where it is for the first time, really in a formal way, started that EU member states and Commission work together. Now to UHC 2030, I'm happy you asked me, because I was sitting today 1.5 hours in the UHC 2030 steering committee we had today.
Okay.
Yeah, very timely.
So you're happier to be with us now, I trust.
Yeah, there is a new chairmanship, and the idea is, in fact, in the context of COVID, I know you will talk about this. We'll talk about this later. To strengthen this platform, at global level, and now the challenge is also at country level. The platform, what has it achieved? It has achieved monitoring reports for the public, how, for instance, the donors are accountable to what they're actually investing in countries, and likewise countries, what are they doing with the funding provided. That's a very, very short and not very comprehensive explanation. So in conjunction between UHC 2030, which is also funded by France and the EU, Japan and other countries, and the UHC partnership, instrument was developed which worked increasingly well. And then, but let's please to the next point, came COVID, and I'll stop here.
Okay, yeah, you're right. And I want to, so thank you very much, Matthias. And I want to clarify for the audience, we've got approximately an hour left to debate the topic. And I want to do it in two bits. I want to first talk about the work that the EU is doing on the universal health coverage and discuss that without considering COVID. I don't want the whole conversation to be about COVID, but of course, COVID has changed the world. And so probably about halfway through, I'll ask more specific questions regarding how COVID has impacted all this. So for those watching us, if you have questions and the COVID ones come up too soon, don't worry if I don't address them immediately. Matthias, that was very enlightening, and I don't know if it's fair to maybe sum up what you said in saying that if you bring all of the numbers together, it sounds like the EU is doing a lot. But actually, if you break it down, the ambitions are not as great as we might hope. But in reverse, because the ambitions are small, they have been successful. There's something I want to bounce back on. Is you mentioned at one point how Luxembourg and Ireland and Japan and then France were getting more involved with donations and so on and so forth. In 2015 in New York, all 193 member states of the United Nations agreed on the Sustainable Development Goals. And together they set out an ambitious agenda, which was ambitious because it was for a safer, a fairer, and a healthier world by 2030. And universal health coverage was a big part of this. Now, we're in 2021, 6 years on. Am I hearing from you that there are countries that are more committed than others? And my question isn't just from a payer point of view, but also from a receiving end. Maybe Alex, you can tell us, how you feel countries react with regards to that. And similarly, Elena, your experience of AXA, are other private insurers around Europe, as in member states, also involved? To what extent are some countries just more into this than others, both on the receiving end and on the giving end?
You want me to come in, or first Alex?
Whoever. The question is
after you, Matthias, after you.
Okay. Just to answer, in spite of you saying this is not about money, it is, of course. The whole program of the EU was 180 million. To achieve universal health coverage by 2030, WHO has calculated, and OECD has confirmed this, it would need every year 180 billion US dollars. Okay?
Okay, so I think we've answered the question. They're clearly not doing enough. Okay.
The question is, how does one mobilize these funds? And then the next question is, of course, how is this better implemented?
And you have 193 states that have signed, but I think all these countries are at very different stages already to begin with. And when we say, are the governments committed, who are we talking about? Because you look at the Ministry of Health, it's not a homogeneous whole, right? And very often it depends on the top leadership and the political leadership of the country. But within a typical ministry, not everybody will be on board. You will have, it's a heterogeneous group of people with different opinions and different ways to look at it. Also, it's, I would say, you shake a little bit a status quo and maybe let me take one step back. I feel that in many countries, at least when UHC was first being talked about, there was a lot of misunderstanding also about UHC. Some people thought, oh, this is a WHO project, or this is they didn't see that as goals. That's what it is, right? These are long-term goals that we set for a health system. And those goals have been there all along since Alma Ata, since the Health for All. I think we put a little bit more emphasis on the financial protection than back then, but they've been there all along. And I think there was a lot of misunderstanding, at least in many of the countries that I visited. And that has evolved, I think. And I think talking about UHC in many of those countries has become more mainstream, and there is a better understanding about what that means and what needs to happen. But then, of course, there's a lot of variation from across countries. And I'll stop here.
So okay, so that's interesting, because Elena, when Elena spoke about how the private sector could help governments implement universal health coverage, it seemed to be that, you know, this is a technical exercise. Private insurers can bring expertise, they can bring, you know, budget planning, long-term visibility. Elena, to what extent do you think the uptake and implementation of universal health coverage is a political rather than technical exercise, or vice versa? Do you think it's more technical, or do you think it's more political? What do you guys think?
Well, I think it's first clearly a political wish, and to be successful, the implementation of universal health cover, it's important to have the right momentum. But once again, the political wish, it's really important. And although all the countries, and especially the low, middle income countries, are having this target in their agenda, still the efforts are not enough, and clearly not sufficient. And when it comes to, although there is a political, in some countries, clear political willingness, the implementation is quite very challenging. And indeed, the private sector can bring a lot, especially in these type of countries, because there is no legacy, and it's quite easier to build a system from scratch. Of course, there is a financial constraint, but and here I will just add, it's a system financed totally with donation. It's not sustainable. We cannot build universal health cover in these countries only relying on donation, because we have seen it during the COVID situation. From day 1 to day 2, external aid may just stop. So you cannot build on that way. But certainly, with external help, it might be a start. As a start, yes, it could be of help. But so yes, the momentum is really important, and once again, implementing is really challenging. And so that's why I was mentioning the private expertise in such a schemes could be of interest. And but sometimes, you know, from what we have seen in some countries, politics are trying, in emerging markets, they're trying to copy paste existing historical models, and actually that is almost impossible, because once again the standard, I mean, Bismarck Beveridge models, and they've been created in a certain...
Wait, I'm stopping you. I don't understand this. You're saying to me that you can start from scratch. You can start from scratch in these countries because nothing's there, but you can't copy paste. I mean, despite its flaws, the world envies our French social security system. You can't cut and paste it and just put it in. If you can start from scratch, why can't we just cut and paste it then?
Unfortunately, it doesn't look like this, but the positive thing here is that this country can rely on the good and bad examples coming from mature countries which have experienced the universal health covers for decades, and which are facing now other problems. Of course, the sustainability is a crucial problem for all mature countries. And by the way, there is no perfect health system. We're still running after. And I would just give an example. The country which is spending the most on a worldwide basis, it is the United States spending more than $11,000 per capita, and this is by far the least efficient. But what I'm saying, and when I say that we cannot just copy paste existing models, is that I will give an example. In most of low middle income countries, the part of the informal sector is almost 90%.
Exactly. So, if I may interrupt you, that is exactly the point.
Yeah.
I was recently in Zambia and in Uganda. Of course, you have your private insurances. I'm sure AXA is there active as well. But if you see the overwhelming part of the population who cannot afford to pay the premium, the contributions, good, then how do you establish, to go back to Raphaela, a Bismarck or Beveridge? Beveridge is state insurance, but Bismarck system, very, very challenging. You don't have the formal sector which can afford to contribute to an insurance system, no?
And the thing is, I mean, this is a kind of stereotype for the private insurance, because indeed, in the majority of these countries, when there is a very little awareness of insurance, and only the very small percentage, I would say 2 to 3% or maximum. Population is what it is, the insurance, and only the healthy could afford for health insurance. But when the private sector, the private insurers are joining forces with the state, the government here has to play a very crucial role in giving the legal framework, and as Alex mentioned, it's important to regulate.
But that's really complicated, because so this is a complete conundrum to me. So what you're saying to me is, we've got the difficulty on the technical side, and you can't cut and paste a system because it's just not possible to implement that. And Alex is saying to me, there's a political alignment that is just not happening, because, as you said, Alex, in health ministries, it's very heterogeneous. You need to get people all together. Am I hearing that these efforts, whether they be national or international, are fragmented? I mean, to what extent is how are we going to bring all this together? How do we resolve this apparent fragmentation between national and international efforts? And to what extent does the EU contribute to bridging that gap? I mean, does the EU do that? I mean, Alex,
now as we're talking, not only now, but since about 2 years, that is, the EU is supporting this. For instance, the Global Action Plan on healthy lives and well-being for all. This is exactly an effort to bring, for instance, all the global health initiatives together to have a common plan. Global health initiatives, one has to explain, are institutions like the Global Fund and against TB, malaria, and HIV, Gavi, the Vaccine Alliance, the Global Finance Facility, which are supplied with a lot of money and have not really worked in a coordinated way. This is exactly the plan. And the EU.
So that's what the EU is doing. The EU is bringing these global initiatives together.
The EU is not bringing this. This is WHO actually, but
it's
the
WHO.
EU is supporting. But the EU is supporting this, and wants absolutely, because it invests. The EU is investing in all these global health initiatives, and of course would benefit from a higher efficiency and synergy of these initiatives. But that is a process, and that goes to what Elena said, or Alex, very much a political thing. If you have in a country, well, I don't want to mention the name, but I was recently in one where within 2 years, 3 ministers of health have changed, and that means you don't have really a continuity. A political.
Okay, so this is very much to Alex's point. Alex, a word on fragmentation and what Matthias and Elena just said.
Yeah, no, I think Elena mentioned the challenges of implementation. True, it's really challenging, and nevertheless, I would say that to go back to your initial question about how much is it political, how much is it technical, I would argue that, I don't know, 80–90% is political. Is really navigating a complex political economy in many countries, but that doesn't mean that the technical is easy. That's not what I'm saying. And I also agree that it's you can't just cut and paste. You can't do that. But it's not that you start on a blank slate either. I mean, there is a legacy in every country. There are maybe what's different depending on how far the country is on its journey towards UHC. Maybe the importance of vested interest that may vary. In certain countries where you have already very strong, for example, health insurance systems in place. I was just, recently having discussion in South Africa, where you have a new national health insurance bill that was passed in 2019, but there's a lot of resistance because it's trying to basically move from a two-tier system to a more unified system. So there are very strong forces to basically keep the status quo. So yeah, and then the fragmentation that you mentioned, I think that varies from country to country. Some countries are better at coordinating the efforts among the different initiatives that Matthias was mentioning. Others are having more difficulty doing that. I think it's a mixed bag, I would say, but it's not an easy process, that's for sure. And sometimes I think that we need to be also realistic as to the time frame for this, because we're often talking about massive reforms, and it just takes time. It's not something that happens overnight.
What I find, I understand that. I really do, and I'm happy you clarified that about the time frame and the complexity of the endeavor that you are all conveying to me and to the audience. I think is very important, because when you read about the topic, it seems like we're pouring in a lot of money and we're still not getting very far. And I think it's very important to flag that, to say it is a complex issue and it is going to take time. My surprise, and so therefore my question to you is, there were 193 states that were committed to this, okay, and that are presumably committed to this. And so I'm just wondering, why is it that it takes time and that it's complex? Yes, but why is it so difficult? And to some extent, my question is, how do low and middle income countries or developing countries, how do they welcome the initiatives that we try and implement? Are they, do they welcome them? Do they, what is their reaction to it? How does it balance what the EU and the WHO and other global initiatives are trying to do when it hits that internal, local, domestic fragmentation, which is in itself in opposition to the visible commitment that these countries are giving?
It's not only this. Number one, it's the challenge to have enough human resources and well-built human resources. WHO regularly publishes and repeats the figures. We have a shortage of 18 million health staff, basically trained nurses, only in Africa. 18 million, yeah. And the other thing which goes in on the line of what Alex just explained, I was 25 years, I left Africa after I worked there, and a country like Zambia had 5 million inhabitants. Today, Zambia has 15 million, 3 times the number of inhabitants. And even if they increase their gross national income to cope within 25 years with tripling of a population, and in other poor countries this is fairly similar. One just has to imagine the United States would have grown in the past 25 years into a 1.3 billion country, or my country would have grown into a 240 million country. It's just not imaginable, but that's the reality on the ground. And so even if governments strengthen their institutions and train more people, with the sheer burden of an undiminished population growth, it is very difficult to keep pace in terms, for instance, providing universal health coverage. One aspect, yeah.
Elena, you seem to have wanted to add something to that?
No, sorry, no? Yeah, absolutely. You're absolutely right, because we have to take into account the demographic aspect, and because in day-to-day healthcare spending, public healthcare spending, it's increasing over the years, but still it's insufficient to bridge the gap. But on top of this, we have to take into account the demographic aspect, because the population in the low middle income countries are still increasing quite dramatically.
Okay, so I want to bounce back on this and ask you maybe a bit of a provocative question. Now, there's this person who, if he's in the audience and listening to me and I don't pronounce his name correctly, please forgive me. It's the global CEO of the NGO AMREF Health Africa. His name is Dr. Githinji Gitahi. I don't know if you've heard of him.
Gitahi Githinji, yes.
Okay, great. Oh, all right. I'll just call him the global CEO of AMREF Health Africa. He recently explained, or at least expressed his opinion in saying that primary care is the ultimate pathway to universal health coverage. And he believes that it's the backbone of a comprehensive healthcare system, and that it's accessible, it's affordable, and it can address more than 80% of a person's health needs over the course of their lifetime. Now, you know, with the growing population that you're mentioning and the demographics, it sounds to me like primary healthcare would indeed be the focus. But to what extent do you believe, and I know that I believe Elena probably doesn't believe this at all, so I'm looking forward to hearing her about this, but also Alex's point of view and Matthias's, to what extent do you believe that steering more spending into primary care and relatively less in secondary and tertiary care will lead to better patient outcomes and ultimately to the goal of universal health coverage? Alex, maybe you can begin?
Absolutely agree. I mean, this is, you're dealing with limited resources. Where do you put those limited resources? Are you putting it in specialized care that will treat a few cases, or are you putting it in, I don't know, basic immunization? So it's a matter of value for money. It's a matter of equity, because a lot of the secondary, tertiary care is inaccessible to a majority of the population in many countries. So I think building on a strong primary healthcare foundation is essential. Yes, I totally agree. And when we talk about universal health coverage, I mean, it's basically bringing the care to the people that they need, but keeping in mind what you can afford as a country, right? So you need to create, to define a clear package which becomes the commitment of the government towards the population, and that package needs to be in measure with what the fiscal space of the country can afford. So where do you put it? I would say put it where you have the best health gains that you can achieve, and that's primary healthcare.
Elena, am I right in believing that you maybe have you've maybe got a contrasted view on that? Am I correct?
No, I agree with Alex. In any case, it's really important to build a robust primary care, because otherwise, I mean, you cannot build a secondary or tertiary care treatment. But in any case, when you structure a universal healthcare system, you have to politics need to have in mind that there is a financial constraint, and it's crucial to know who shall be covered and to which extent, what's the scope of cover. When Alex was mentioning packages, clearly it's important to know for which type of care you would like to cover certain all the population or partially the most vulnerable. So that's really important, and financing it clearly has an impact on that. And clearly in the majority of low middle income countries, there is very limited secondary care offered for free, and almost no tertiary care offered for free. And sadly, these are the most catastrophic expenses, and which are either leading to clear death either leading to a vicious circle of poverty and trapping the most vulnerable in a poverty cycle. So and on top of this, it's because of the lack of clear data and clear registry, it's really difficult for politics to build a long-term, I would say, long-term health policy. And so, because for decades, these countries were struggling with, and still now, with communicable diseases, and which are predominantly part of the primary care. Still, the focus is mainly on that, but in the same time, because of the lack of data that I was mentioning, there is a lack of awareness that the non-communicable diseases threat is really crucial. And today, as per the last reports, almost 80% of the non-communicable deaths occurs in these countries, and so it's really important to pay attention on the tertiary care. When I mention tertiary care, it means cancer, cardiovascular diseases, neurosurgery, etc. So it's these are really the expenses which are really catastrophic, and it's important to pay attention on that as well. But once again, primary care, of course, it's important, because if the primary care is not strong enough, then how you can be treated for cancer if you are not able to know that you have cancer?
Yeah.
Matthias, we have two opposing views here. We've got Alex, who is very clearly a pro primary care, invest in that, and Elena is a bit more measured. You know, secondary care and tertiary care is a hidden growing burden, and it costs a lot, and it's catastrophic. What is the EU standpoint? And when I say EU, I mean, you know, what is your feeling of member states? Of what is the feel for in institutions? Are people still very focused on primary care, or I mean, Elena mentioned the awareness of the growing burden of non-communicable diseases was not high enough in low and middle income countries. What about in member states and in the European Union? Is that awareness there?
Whether primary healthcare is a priority for member states in the European Union,
Okay.
I would say yes, increasingly, but universal healthcare is primary, secondary, and tertiary care, meaning really the basic services, the district hospital, and then the specialized services, all three. I understand Githinji very, very well, because he comes from Amref, from a country, from a continent where primary healthcare is not really provided, Kenya in this case, and surrounding countries. And if people do not have access, and that means that they can reach in reasonable times and over distances primary healthcare, you will not achieve universal health coverage. It is also clear that specialized centers have to exist. I worked for a couple of years in the Balkans. There you had, of course, ex-Yugoslavia, there you had, of course, fantastic clinical centers. But if people were affording, they would go to Austria, Switzerland, Germany. No, you want to keep the health economy in a country. Therefore, it is, of course, important to strengthen all three levels. But it starts absolutely with access to primary health care. Yeah, I would totally agree. Yeah. And the EU has the same, of course, that is the philosophy of the EU as well. Yeah.
And I think you just mentioned Kenya, which is interesting. I think there is an amendment being proposed for the NHIF, the National Health Insurance, the National Hospital Insurance Fund in Kenya, which one of the proposed changes is to put more emphasis on prevention and promotion. Yes. And I think that is a critical part of primary healthcare that can actually help reduce the cost for secondary and tertiary care.
Correct.
So
absolutely.
I think it's also it's very important to invest in that as well when it comes to non-communicable diseases.
Absolutely, and exactly. So as you're saying it, I wanted to answer to this. The EU has topped up its funding in the last phase, as we say, particularly to address NCDs, non-communicable diseases, so hypertension, diabetes, cardiovascular diseases, because we all realize that these are the lead group of diseases, even in low-income countries, increasingly. It is still malaria and tuberculosis and HIV, but it is the non-communicable diseases which need to be addressed, and this was clearly and is clearly the policy of the EU. Yeah.
Okay, so we're almost halfway through the last hour that we had, and I want us to talk about COVID. In early 2020, as the COVID-19 pandemic began to ravage the world, the European Union sprang into action with its member states and financial institutions to deliver a collective global response. And they wanted to lay the foundations of a more unified European approach to international development. And this is what Matthias mentioned in his introduction. It was termed Team Europe. And so now we have what we call TEIs, which are Team Europe initiatives. With a combined 40.5 billion euros in aid pledged since the start of the crisis, Team Europe's support to help developing countries tackle the immediate health needs and mitigate social and economic consequences of the pandemic have been an unprecedented attempt to combine European expertise and resources in the face of the global crisis. With that in mind, to what extent has the pandemic jeopardized, if at all, the universal health coverage objectives? And on the contrary, is it the case that the crisis has seen a strong argument for accelerating our efforts? What do you think about that?
If I may just start, because I'm following still some countries where the EU is investing, and the clear effect of COVID a year ago was that the human resources and financial resources which were allocated to health system strengthening, health financing, human resources were massively shifted towards the emergency preparedness and response to COVID. No question about this. And over this, for some time, countries struggled, and organizations as well, to keep the effort to support universal health coverage through whatever programs going was challenging. This, however, has been realized that we cannot just address COVID at the short term, but it has to be a beyond effort. And this is where the Team Europe initiative comes in. This is where the Team Europe initiative also comes in various areas. The president of the European Commission has said, okay, we would like to support medicines and pharmaceutical productions in Africa. Now, this is an endeavor, of course, of 10 to 15 years. It is one of the outcomes of COVID, saying, good, we must support African countries to produce, for instance, their own medicines and vaccines. This requires immense investment and will not happen in 1 or 2 years, but this is one of the positive collaterals, I would say, of this pandemic. Yeah.
But okay, so bouncing back on that, to what extent has this emergency surge of financing for COVID, to what extent can it be sustained? You know, I mean, how do we do it? So basically, there's been a flooding in of money as a response, and one of the people in the audience actually asked, you know, this is something that has been in response to the urgency of COVID, but how do we make sure that this is sustained in a longer period of time? Elena?
Well, I think the COVID situation has underlined the need of a strong health system. That's for sure, and just draw the attention, focusing on that, and I would say using digital health during I mean, just has evidence, but not only in emerging countries but also in mature countries. It was a good example to underline that we may rely more on digital health to reduce the healthcare inequalities. So it gives other opportunities. I would not say that the COVID put on hold the universal health initiatives. It's just, I think it's really draw the attention on the real needs to build a stronger health system.
So it's been positive in showcasing to what extent we need stronger health systems. That's what I'm getting from you. Alex, I know you agree with Elena on the whole digital health and how digital health can considerably change the landscape. Can you tell us a bit more about that and your thoughts on that?
Yeah, no, I think there's digital health and also self-care. I think there is a growing understanding that a lot of health services that used to require a medical or clinical person to deliver that service can now be moved to the household thanks to advances in technology. So both these new services, these new products, but also the digital. And what's interesting is that you see many countries where there was a lot of resistance in terms of, for example, telemedicine. With COVID, have now accelerated their transition to using more digital technology to deliver services. So, and also, I think digital in terms of self-care, like the symptom checkers, digital symptom checker, digital signposting, which helps the consumer or the patient determine what the best next step, where to go to, if anywhere to seek service. So there's definitely the COVID has accelerated that movement. COVID has also, as already mentioned, highlighted the fact that UHC prior to COVID probably underestimated the importance of emergency preparedness and response. I think that's now, everybody will agree with that. So I can anticipate that much more money will go into that area. Yeah, so I think that answers your question.
Matthias,
Totally
what
agree.
is, yeah, okay. That's an easy answer, Matthias. No, what I meant was, you know, what is to what extent can the European Union institutions take on this digital and self-care initiative as maybe a pillar of future endeavors? I mean, I'm just thinking of teleconsultation. I know, Elena, correct me if I'm wrong, I believe AXA is very good with teleconsultation, at least in France. I don't know how they're doing in the rest of the world, but I seem to remember that they were the one who helped the French government realize that teleconsultation was the future. To what extent could the European Union, you know, leverage these health initiatives, these
nice question.
initiatives?
Nice question, because you're exactly echoing the new strategy of the European Union since 2019. And there are 5 pillars, and one of them is, of course, technology and digital for development. Exactly. And digital health is one part of digital for development. And what the EU is planning, and I'm supporting the colleagues in the Commission now in the preparation of future programs, is to do again with the Team Europe. That means with other member states. So not to do it in isolation, but with the implementing agencies of EU countries to support national governments, where national governments have expressed their wish to go digital. Guinea in West Africa, for instance, is one which is just starting, and there the EU is providing the first experts for it. It's just the beginning. Others are far advanced, like Ghana and Rwanda, and there the EU is pursuing a regional approach, rather trying to make sure that the regulatory, the technical as well, and then particularly the interoperability issues between countries can be addressed in time. This is one of the big programs of the EU for the next 7 years. Yeah. Independent of COVID, one has to say, independent of COVID. This was decided in 2019, but COVID, I would say, is there an accelerator of unknown dimensions so far, unseen. Yes.
You three are. It's a delight to talk with you, because you're incredibly positive, or at least you're giving a very positive shine on COVID, and you're saying, you know, it's accelerated these initiatives and it's shining light on the need to do more, and more money's coming in, and so on and so forth. But there is an economic downturn awaiting us. You know, one of the things that COVID has shown is the fragility of our own health systems in European member states. You know, what do you say to people who could be inclined to say to you, actually, do you know what, we really need to fix our own health systems before helping low and middle income countries sort themselves out? And how are we going to manage supporting financially low and middle income countries with the economic downturn that's coming along? And by the way, I think that is summing up a bit of the questions that I'm getting from the audience. And if you want to give me shorter questions, it'll be easier for me to read. But I do appreciate your participation, to all those who are sending in comments. So yes, to the speakers, economic downturn, should we be selfish and think about others afterwards? What are your feelings about this?
I think there are many parts in your question there. Yeah. One is, yes, at country level, in low and middle income countries, I mean, the economic crisis that these countries face has definitely long-term impact on their financial resources that will go to health. And obviously, you know, when we look at past epidemics like Ebola, or there is a clear lesson that you should probably invest more in your health system. But at the same time, there are many competing priorities, right? So it's really tough for many countries to balance those priorities in times of crisis. And absolutely right. I think there is the COVID pandemic has clearly shown that basically the insular shift to a more insular mentality for many countries. But that's at the same time the realization that as long as there are countries that still struggle with COVID, the whole world struggles with COVID. So that insular mentality cannot last. At some point, we need to realize that everybody is in it together, and but that shift still needs to happen when it comes, for example, to vaccines and other areas. Yeah.
Alex, I'm pushing you further. Tell me about that story about Nepal, because that was the story about the vaccines in Nepal, and can you share that with us?
Oh, that's not only Nepal. I think I mentioned that because I just came off a call on that day, but it's also for many African countries. I think the COVAX that's supposed to provide vaccines has a lot of the vaccines are coming from production sites in India, which are now, and India has stopped export because of the amplitude of the crisis, COVID crisis in India. So that means that many countries, including Nepal, but also many countries in Africa, have population. A part of the population has had already the first AstraZeneca vaccine, but they won't have the second shot in time because of these limitations in supply. So that's a huge issue for many countries right now.
And Matthias, when we talked, you had a frightening statistic. I can't remember the numbers, but can you share with us that statistic? Yeah. Because the statistics.
Yeah, the statistics is that if we look at the distribution of vaccines, 90% of the vaccines go to high-income industrialized countries, and 2% of the vaccines have been, or the other way around, 2% of low-income countries have been vaccinated. So this shows, of course, the initial egoism, but on the line of Alex, we are not safe until everyone is safe. It's the big slogan at the moment of WHO, but it's true. We can, of course, assume, okay, it will happen with COVID as it had happened with Ebola, 1.5 years, 2 years, and then it will be over and we are above it. This is a little bit unlikely given now the nature of the virus, and the big difference is that it is global. Ebola was never global. And HIV, an epidemic I started my clinical work in Africa with, was of course a pandemic, but you knew how to prevent it. And this is the big difference here. Yeah.
I really wanted to take a moment to pause on that, because when I was talking with you in preparation of this debate, I feel that those are eye-openers. And for the people listening to us today, I really want to re-emphasize that point. What Alex said, we will not be safe with regards to COVID until, you know, the whole planet is safe. And at present, only 2% of low and middle income countries are efficiently vaccinated. Correct, Matthias? That was the number.
That's correct.
Elena, I want to come back to you. and please tell me if I'm wrong, but my understanding of how the insurance sector as a whole works is that there's an enormous amount of competition is not the core of the insurance sector. My understanding is that, you know, when you have reinsurance, for example, you all reinsure one another, and there's an enormous amount of cooperation to insure big projects. I'm thinking in the aeronautics world, for example, there isn't one insurer that insures, you know, an airline company or whatever. So there's a lot of collaboration, of partnerships, of understanding. This contrasts very much to the competitive attitudes of European countries in the context of COVID. COVID produced very different outcomes around the world, and internationally, countries were very competitive. You know, we got the vaccine first, we paid to get the vaccine. I will deliver, I will not deliver. This was not the brightest moment for European member states, for European institutions, and for countries as a whole. The problem is that this competitive attitude towards supplies and towards accessing the vaccine is contrary to global interest. And I'm just wondering, how likely is it to harm countries and citizens? And since you're from a private sector that is not so competitive, can you perhaps you know, give us some insight on that, on how we could try maybe to mitigate this competitive attitude and support those countries that have less economic and political bargaining power?
Well, it's a very, I mean, the current situation that we're living is a historical one, and it's clearly it shows that we cannot, although there are some political positions and protection and national protections that is put in place, but once again we cannot act as an isolated island. So we have to interact, and by the way, it interacts in just taking the example of how quickly this virus spread across the globe, and it is still evolving on a daily basis. So we should interact to do somehow, but it's a very tricky situation.
Are you hopeful? Are you hopeful that we can get over these competitions, these national, and the question's not just for you, Elena, the question's for all of you. Do you believe that we can transcend these national competitions and these individualistic feelings to support the poorer?
Go above this. I mean, because otherwise I mean, if you take one specific country, it cannot be isolated from all the others. It just doesn't work, because nowadays the economics are so much imbricated, and I mean, you can just not be self-sufficient enough. I mean, we rely on foreign providers, and it just the economy cannot stand on an isolated basis. So
Alex,
sorry.
Well,
so you're hopeful, Alex, Matthias?
I think only a few days ago, a week ago, so there was I think the IMF was presented a plan of 50 billion that would cost 50 billion to basically bring the pandemic to an end faster in the low and middle income countries, reduce infections, accelerate economic recovery. But for that, I think you need also to invest in vaccine production. You need to diversify production to the regions with little current capacity. You need to share technology. You need to share know-how. You need to find solutions to intellectual property issues. So all of that needs to happen, but it needs to happen now, right? And is it going to happen? I think there's definitely there is pressure to make it happen, but we'll see.
I don't think question marks. Yeah, I agree. I mean, one of the ways would be, in order to increase vaccine production, to ask European companies, the private sector, in other words, to invest heavily in African countries. Well, good. The first thing they would look at is the feasibility, the stability, the legal framework, the human resources, just to mention, and then whether there is actually a market. Of course, with 1.4 billion people in Africa, there is a market. Yeah, but is there the capacity, for instance, to then buy medicines from local productions? It's happening already, but this will not be answered within a year or two. It's a long way. One person in the audience asked, should one act fast or longer lasting in COVID? I think both is right. We have to address the urgent problems now, and we must keep continuing of what we have embarked on, because otherwise a lot of money will be wasted. That's secondary, but a lot of more people will die, no? Because this is
so Matthias, I have a question. I have a question really actually for you, because you talked about the Team Europe initiatives at the beginning, and we mentioned them when we started talking about COVID. Now, correct me if I'm wrong, but from what I've read, the EU is currently preparing as many as 150 Team Europe initiatives at the national, regional, and global level. But currently, from what I've read, and I believe that the paper I read dated from May this year, so it was like, 20 days ago, there are 49 that have been properly planned and thought through, and there isn't a single one on health. There are only 3 on education, and the vast majority are focused on transitioning to a green economy. And the mind boggles, talking with you for almost an hour and a half about the importance of health and how, this is going to impact the economy and the future. And how could it be that these Team Europe initiatives are all focused on the green economy?
Yeah, okay, the answer is because the strategies were identified 2019 by the member states and the Commission, including the famous Green Deal, digital technology, migration and mobility, economic recovery, something else, and security, right? Health was not really the focus area. Now this changed, of course, unfortunately, or fortunately, as you like it, with the beginning of last year. And there are now Team Europe initiatives, which cover basically 4 areas: regional approaches with EU member states in the area of One Health. So not only looking at human health, but environmental health and animal health. On public health institutions, meaning exactly to do the preparedness better. And then on health security is the 3rd one, and the 4th one would come on digital, if I remember this right. These Team Europe initiatives, together with the EU, are in the making in the moment. Yeah.
Okay.
No, there are.
They are, okay, there are. So this has improved, but it's just a concours de circonstances. The circumstances are such that it was more focused on the green economy, and then COVID came along, and
yes.
Okay.
No, certainly that was a how do you say, a booster. Yeah.
Okay. So the 3 of you, I've got a representative of the private sector, and I have a representative of international organizations, and I have a representative of civil society, which is PSI in my category. The UHC 2030 mission is to provide a platform for the private sector, civil society, and international organizations to collaborate with governmental organizations and academia to push UHC forward. As individuals representing these sectors, do you feel that you have been engaged? Do you, Elena, as a private sector person, do you feel that you engaged on UHC and that you've been, proactively engaged in it beyond what your own company does? Matthias, do you feel that the EU is engaging its member states? And Alex, do you feel that we're giving enough attention to the voice of the NGOs?
The voice of the NGOs, I would say, that brings me back to the one of the points I made in my introductory comments. The voice of the consumer, I think, has not made it to the policy discussions, and I think that's really something that we need. And COVID again makes it even more important, because we want to bring services closer to the consumer. So I think that's a priority. moving forward in the UHC agenda.
Well, I was sitting on behalf of the EU for 5 years in the steering committee of UHC 2030. I was not only involved to address your last question to come, but also committed, because this is a unique opportunity with the constituencies, as Alex just says. Really the problem, I don't want to euphemize and saying a challenge. No, the problem is that in the moment with COVID, UHC 2030 has to address this as well. And this was exactly what the steering committee today was about, to have not only visibility, but to have an added value in the discussion. How do we address long-term the health response and the support to UHC after COVID? Well, that's the challenge. Oh.
Elena?
I would say that it's really important to engage in a common efforts, and it cannot be just once again an isolated efforts. It's really important to have the local political willingness to build a sustainable universal health cover, and I'm optimistic in thinking that joining efforts, and clearly the private sector can help in bridging the gap in terms of I was talking about private insurance and giving helping in structuring efficient system, but also in bridging the gaps for the in terms of lack of infrastructure. We were discussing about digital devices to help to cope with the lack of infrastructure, and I think it's a global common efforts, but I'm pretty much optimistic.
Okay. Right. I just want to, we're coming to a close, and I think you thought it was a final question, but it wasn't. I just want to sum up a bit of the ideas we discussed. So in the first part, my understanding is that UHC is 90% a political challenge, although there are real technical difficulties that need addressing, and for which the private sector, together with NGOs and EU institutions and member states, can begin addressing them. The EU has been supporting the WHO towards bringing together the global initiatives, which, to be honest, is great, because it's a bit of a headache to have all these different initiatives, and having a bit more of a harmonious whole will help, and will certainly help address some aspects of the fragmentation that we mentioned between national initiatives, international ones, and also the fragmentation within, ministries and governments as such. I think it's very important to remember how complex universal health care coverage is, and that it will take not months or years, but probably decades. And I think we all agree that universal health coverage covers both primary, secondary, and tertiary care, and that they're all as important on the long run. And so we need to address all of this. I'm very grateful, because your analysis of COVID was very positive. There's actually somebody in the audience who I'm sorry we weren't able to answer all of her questions, was a bit more negative in her involvement, and said, there are geopolitical changes that are happening that may put a slightly more negative look on your perspective, but your perspective was very positive, because you seem to say that, thanks to COVID, the need to address and to strengthen health systems has never been so blatant. Right. And something that gives us all a bit of hope is the inclusion and the innovations in digital and self-care, and how all of this will help move the agenda forward. It was very interesting that you said, and I took a moment to share this with you and with the audience, that we will not be safe until we are all safe. And so we all need to make sure that we address COVID as a global planet, as opposed to individualistic or nationalistic countries. And I think the idea that the voice of the consumer and the voice of the person has not yet come through in all of this. And so despite the engagement of the private sector and the engagement of institutions and member states and the engagement of NGOs, we still need to have the voice of the consumer coming through. Matthias, you mentioned the two words that I adore in English, involvement and commitment. When I'm asked, or when I ask students or colleagues, do they know the difference between involvement and commitment, I tell them about eggs and bacon. As a true British person, I eat eggs and bacon for breakfast. And when you make eggs and bacon, the chicken is involved, the pig is committed. And so my final question to you is, do you believe the EU and its member states, so the EU institutions and the member states of the EU, are they involved or are they committed to universal health coverage?
If you ask me, I think through this lessons learned, if they were not before, there are now more than before. Absolutely, yes.
They're more than involved, or they're no more than involved?
Committed because
they're committed.
They see the existential challenge to them. There's no question.
Okay.
Yeah.
Okay, so committed. Elena, is the EU involved or committed to UHC?
I think there is I mean, from a private perspective, or
no, just from talking about it with this discussion. Do you feel that member states? I mean, you know, you're a European. You come from several European countries. Do you feel that the European countries are committed, or are they just involved in UHC?
Well, clearly there is a commitment, but
okay.
It's important to somehow to be clearly involved. I mean, to move things forward. But once again, it depends also on the local political willingness. But clearly, there is a commitment. Yes.
There is a commitment. Alex.
Well, I hope there is. I hope there is a strong commitment.
Okay. Okay. So to the question, you know, universal health coverage. Is the EU doing enough? I think we can safely answer that our three speakers agree that the EU institutions and member states are clearly committed to UHC. Whether they're doing enough, it remains to be seen, but at least they're committed. Sadly, we're coming to the end of what I believe is a very thought-provoking discussion. And I want to thank today's three distinguished speakers. So thank you, Elena GRAEFF, Alex Ergo, and Matthias Reinicke for your answers and for your questions, because you asked one another questions, and that was great. I want to thank the audience that, alas, I cannot see, but that did send in questions. And if you feel frustrated that you haven't had the answers, which I can completely understand, you know, please do not hesitate to send them through to Europa Nova, who will share them with our speakers, and probably they'll get back to you. But in any case, thank you for contributing to the debate. I want to thank Europa Nova for organizing Conference Europa, especially the Executive Director, Corentin Gorin, and Joseph, who looked after the logistics and who enabled us to all be able to chat the way that we did. The next Conference Europa event, because Conference Europa is, it used to be a two-day event where we all got together, but today, because of COVID, we're doing things differently. So we're having them on Zoom, but with the hope of reopening, and that's what will happen on July 1st. There will be a Conference Europa on Zoom, but also in our headquarters in Paris, and it will be on the topic of the Green Deal. So if you want to register and find out more information, it appears on your screen now, and you can register on europanova.eu. Thank you again to all of you, and I look forward to seeing you at this next Conference Europa. In the meantime, stay safe and goodbye.
Thank you very much.
Thanks.
Thank you very much.
You.
It was great.
Bye.
Stay safe. Have a good evening and good morning. Bye-bye.
Bye.